Good morning. My research paper is the effects on short-term breathing exercise on respiratory recovery in patients with COVID-19. For this study, it is for between moderate to severe patients. And the study was conducted in a Bangladesh. And from my understanding, those hospital systems were extremely overwhelmed at the time of COVID, as most were. And this study was conducted to 173 people. And the parameters they used were need for oxygen therapy, respiratory rate, heart rate, and the oxygen saturation. And these breathing techniques they used were slow breathing, diaphragmatic breathing, coughing, huffing, deep breathing, thoracic expansion as well. And they took the parameters again 4 and 7 days later, and every single parameter they used all went down, which is awesome, crazy. Something that doesn't require any resource other than someone to teach the person how to do it. Perhaps if there's no beds available, it's something that they can instantly give to someone to get them to the next day, the next week, and have immediate results, which have no side effects, takes no resources other than the person teaching that person. And the results indicate that the breathing exercise work. Yeah, for the parameters were only taken 4 and 7 days after, and there's no further study to say how much further along they assisted, but at least it's something that they can use straight away, especially for places that are overwhelmed. And just because there's no long-term studies done on this, if the results are there, I think it is worthwhile spending time there or investing energy there. So yeah, it's interesting to see what would come of that long term. And from my understanding, they did use this for 173 people just as preliminarily, and then they got their further assistance later on. So, but yeah, that is the research. I think it's awesome, and I think it should be used more worldwide, not just for COVID-19. Yeah. Yo.